Okay, this video is going to go over the motions of the scapula. So we've got the scapula. Let's talk about our right scapula. Remember that there are 2 translations and 3 rotations. All right, let's talk about the translations first. So we can glide superiorly and inferiorly, or we can glide laterally and medially. But remember that the rib cage is rounded, okay? And that the scapula is attached to the clavicle up here, all right? So if we have superior glide or inferior glide, that's motion superiorly or inferiorly along the rib cage, all right? We can also have lateral slide or glide and medial slide, okay? Remember that those are component motions is the word I'm looking for. They're part of a curvilinear motion that actually happens in reality. All right. So the 3 rotations are we have upward or downward rotation. All right. Remember, upward or downward rotation is defined by the motion of the glenoid. So upward rotation would be this direction. Downward rotation would be when the glenoid moves inferiorly. Upward rotation is the same as lateral rotation. Lateral rotation is motion of the inferior angle laterally or the inferior angle medially. Okay. We also have internal or external rotation. So internal rotation would be when we rotate this way. External would be the opposite way. Internal rotation can also be called anterior rotation. External rotation can also be called posterior rotation. And finally, we have anterior and posterior tipping. So we have anterior tipping when the superior angle moves anteriorly, and posterior tipping when that superior angle moves posteriorly. Okay? So those are the 3 rotations and the 2 translations. In reality, we don't move in any of those isolated motions. We move in what's called curvilinear motions. We have essentially 4 curvilinear motions, which are a combination of the translations and rotations. So the first curvilinear motion is elevation. And elevation is a combination of upward slide and upward rotation. So how we truly move, when you want to shrug your shoulder, we don't move straight up, because what would happen is we'd fall directly off the rib cage. We also don't rotate just purely, because again, we would move off the rib cage, or we would lose the connection with the clavicle. So how we move is elevation, which is a combination of upward slide and upward rotation. Depression of the shoulder, or of the scapula, is going to be, again, a curvilinear motion. It's a combination of downward slide and downward rotation. So it's going to be a combined motion. All right? So elevation, depression. The other 2 curvilinear motions are protraction and retraction. So protraction is that movement forward around the rib cage, and it's a combination of lateral slide and internal rotation. All right? And again, it all has to do with we can't move in a pure transitory direction, again, because the rib cage is rounded. So it's a combination of that lateral slide and internal rotation produces that protraction motion. Retraction, which is sort of that pinching together of the shoulder blades, is a combination of medial slide and external rotation, right, or posterior rotation. So retraction, again, is not a pure slide. It's a combination of that slide and rotation. Okay?